Hello, this is Dr. Keith Miller, former PCA president, and I'm contacting you today about legislative activities. Recently, I contacted about 60 doctors locally for my local representative who is a sponsor of House Bill 1106 and who may be one of our prime sponsors of our upcoming copay reform bill, which will peg your copay at no more than 20% of the allowed charges and set your minimums, yes, the minimums of how much any insurer commercially in the state can pay you to no less than the Medicare minimum rate. Now, a lot of you complain all the time, what is the PCA doing about this? What is the PCA doing about that? I'm not going to give you my dues or do this or do that until the PCA does this first. Well, let me explain two big things to you. Number one, we need you. We need your time, your energy, your resources, your money, and your campaign contributions to get things done. Things don't get done without people and money, especially in politics. Number two, a lot of you complain that the PCA is not doing enough about getting your reimbursements higher. Well, remember, we can't do your contracts. We can't fight your contracts. If you signed your contract, you signed your contract. And remember, there's a federal law that prohibits us from directly getting in the middle of your contract, talking you into not signing your contract, or negotiating direct dollar amount rates for services. But what we can do is pass a bill making certain things legal or not legal on how insurance carriers act. And that comes down to this. Legislatively, then, we need to pass a bill. We passed the bill in 2012, for some of you who are old enough to remember, when a lot of the insurers, Highmark being the number one person to do this, would you one day all of a sudden get a letter in the mail that you're being audited for 9 years, and they're going back 9 years, even though legally you don't have to keep your records and notes for more than 7 years, and they wanted $1 zillion back. And that was a ridiculous financial burden on doctors. They would say it was because of billing and coding stuff. But the reality of it is it doesn't take 7, 8, or 9 years to figure that out. And the PCA in 2012, with my representative in a bill that I helped write, Senator Chuck McElhenney out of my area in Doylestown, Pennsylvania, in Bucks County. Why am I telling you that? Because once again, I am trying to get one of my representatives who realizes how unfair it is that his constituents are having copays of $75, $80, $100, as high as $140 copay we've seen recently for an insurance carrier that will never, ever, 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 ever pay me $140. The copay, even with the exam, therapies, adjustments, and everything else, the copay would be higher than my maximum reimbursement would ever be. That is not insurance. That is a scam. That is insurance carriers taking people's money and paying zero of their dollars back while telling patients that they're getting 20 or 30 visits per year. And let's not even talk about the pre-authorizations that go with that on top of it. Why am I going through this whole diatribe? Because if you want higher reimbursements, if you want to update our scope of practice to be able to do things that we are not able to do in Pennsylvania that every other state can, if you want to get delegation restored that was taken away when the State Farm matter happened several years ago, we have to do that through legislative means. So I met with my representative. I brought other chiropractors. Unfortunately, only 3 other chiropractors joined me, and their picture hopefully popped up sometime during this video or is with it to show that meeting. But I invited about 60. I only got 3 to come. And what am I telling you with this? Is that if you want things to get better for you and your profession and your patients, you have to get off your ass and stop complaining and hoping that somebody else does it for you. Today is a good day for a good day. That's why I have the sign behind me. Because things only get better if you make them better. Stop bitching and stop complaining. Join the PCA. Join the fight to make it better for your patients and yourself. Join the PAC. Make friends with your local representatives. You know how we pass bills? People in Harrisburg have to vote for those bills. You know why they vote for those bills? Because you made a relationship with them. You go to their campaign events. They meet you. They like you. They trust you. Once they like and trust you, they will listen to you. You will explain how your patients are being exploited and how they're not getting the benefits and the care that they pay for, and how these copays are getting so ridiculous, especially with high gas prices and food prices, that they either have to pick between paying their rent, eating, or getting care for their sciatic pain, and they can't afford the care for the sciatic pain because they have to eat. So they're going to work hurting, trying not to miss work because they have no choice, because the copay is $140. So you want things to get better? Stop complaining. Get off your ass. Join the PCA. Make donations to the Political Action Committee at the PCA. Go make friends with your local representatives. Ask your fellow chiropractors to show up to those events. There's 3,800 plus chiropractors. If every one of you watching this video and every one of the 3,800 got involved politically, guess what? Things get better tomorrow. Your patients' lives get better. And guess what? Your life gets better in the process. Help us at the PCA help you. It only happens when you get involved. Otherwise, I guess you're going to ask for the tooth fairy to leave better copays under your pillow. Dr. Keith Miller, former president of the PCA, asking you to help yourself. Bye, everybody.